As Michigan grapples with a devastating new surge in coronavirus cases, healthcare workers are now working without an important vaccine. The state had big plans for the Johnson & Johnson shot before it was paused, with those in hard-to-reach rural communities expected to benefit the most. NBC News correspondent Ellison Barber joins us now from Alpena, Michigan. So, Ellison, for rural communities there, the J&J vaccine was an important tool, different from Pfizer and Moderna, right?
Yeah, that's right, Joe. So Johnson & Johnson really opened a lot of doors, especially for rural communities, not only here in Michigan, but really across the country. In a lot of rural communities, hospitals, doctors' offices, if they're there, they're small. They often did not have those super expensive freezers that were necessary to store the Pfizer vaccine and sometimes even the Moderna vaccine, not to mention they were having to ask patients to drive often 30, 40 minutes each way just to get a vaccine. That's not always feasible for people to do once, much less twice. Just to give you a sense of how spread out things are here, let me show you this map. So we're in Alpena right now, kind of the bigger city center area, if you will, here in Northeast Michigan. It's kind of down here in the Midland area. So Alpena, we're at a hospital, a doctor's office area in town, but we've spoken to a lot of people who live out in all these areas where for them to get even to a vaccine clinic in this area is going to be really difficult because getting to town can be quite a hike for many people. So places like Mid-Michigan Medical Center decided that maybe they could reach more people faster by packing up the Johnson & Johnson vaccine and just making those drives to administer the vaccine in people's homes. Listen here.
For us, it is reaching that population of people who may not have access to a vaccine, and how do we get that to them in these rural communities. It could be 15, 20, 30 miles to a vaccine center. And this is not 15, 20 miles on a freeway. This is potentially two-track roads, they're dirt roads, poorly traveled. So there's the distance to travel. It's just the access issue that really becomes a barrier.
So doctors and nurses are taking the Johnson & Johnson vaccine, or at least they were, in what is essentially a beer cooler, and then also taking a duffel bag like this one. I'll show you what's inside it. It's pretty much a vaccine clinic in a bag. They have Benadryl in case anybody were to have some sort of reaction. The gloves, the syringes, the disposal for the syringes, all the things you would need to give a vaccine. But instead of asking people to drive 30, 40 minutes each way, they are able to do this in people's homes. And because Johnson & Johnson is not as volatile or as temperamental, if you will, as the other COVID vaccines that are available in the United States, this sort of thing was a whole lot easier when Johnson & Johnson was a tool in their toolkit. Joe?
Ellison, I know you made the drive. You visited with some of the people who have benefited from this program. What did they have to say about it? And has anyone now had to have their appointments canceled because of what's happening with J&J?
Yeah, so they just started this program where they've gotten everything together to go out to people who were identified as homebound and who really had a lot of obstacles, be it health-related or a lack of funds, cars, transportation, to get to a vaccination clinic. So they'd already gone out and vaccinated about 50 people at home. They had plans to vaccinate 30 more on Monday, but now all of that has been stopped. We met two brothers who were part of that group that did get vaccinated a couple weeks ago. Here's some of what they told us. How much easier is it having somebody just come to y'all?
So much easier. Oh, yes. I had to have someone give me a ride because I don't have the automobile.
So for that brother there, his name's Robert McMahon, he told me he has spot memory loss. So if he makes an appointment to go to the doctor's office, he often just simply forgets to go. He also does not have a car. He can't afford to buy one, even if he wanted one. He gets Meals on Wheels delivered every single week because he can't even get to the grocery store on his own. He lives a good 30, 45 minutes away from here each way. So for him, there really was very little likelihood that he could get vaccinated, even though he wanted to, if he had to come into town. So that was a huge opportunity for him that he could get vaccinated with Johnson & Johnson. And now there are other people who are in similar positions, Joe, that can't as long as this pause lasts.
Yeah, folks all around the country in that position. Ellison, thank you so much. Appreciate your reporting.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.